Hi there, and welcome to Fracture Friday. And we can say find the fracture, but this one's going to be pretty easy. Now, this was a mid-70s female who rolled her foot and ankle and ended up with a Jones fracture. We're going to talk about what is a Jones fracture. Come on in here and take a look. And right here is the fifth metatarsal base, and this is your Jones fracture. We'll get into the difference between a Jones fracture and an avulsion fracture down here, and there is a major difference. Now, we look at the oblique view and zoom in here, and you can see here is the fracture line, and then there's a gapping here on the lateral aspect. Again, Jones fracture here, avulsion fracture here. Now, when we go to the bone model, this is your Jones fracture area. Your avulsion fracture is down in here. The difference is there's arteries coming down into here, arteries coming into here, and there's a little zone of not so much blood flow right where the Jones fracture is. And that is what makes a Jones fracture one of the most difficult fractures to heal in the body. So when there's a little bit of displacement here, this can heal. When there's gapping, we start looking at surgical options. Or if this is an athlete or a professional athlete, we're going to put a screw across there to pull that together to optimize healing. An older patient like this, not very active, she opted for conservative care, and actually this has been several weeks into it, and she's healing up great with conservative care. And actually filling in here, because she did have bone close together here, she had sort of a scaffold to work upon. So she's doing really well with this, but a lot of people get confused, or if you're at a facility that's not a foot specialist, of an avulsion fracture, which would be here, is really easy to heal. Lots of good blood flow. The peroneal brevis tendon comes in, wraps around this area, makes it more stable. They heal extremely well. But you move a couple millimeters and it becomes one of the most difficult fractures in the foot to heal. So you really need to be seeing somebody who knows what they're talking about, because it could go from easy healing to the worst fracture, and a big difference between a boot, cast, crutches, or surgery when it comes to the Jones fracture. Hopefully I give you some Jones education today, and you have a great